Excuse me, doctor. My mother has this problem. The doctor gives my mom Tiglit, a blood thinner. Tiglit, the blood thinner, and also Lipitor, the cholesterol clearing medicine. So I noticed that her cholesterol level has improved using E-Life. Should I stop the Lipitor altogether? And also because the blood circulation has improved also, should I stop taking it altogether? That's my question.
Okay.
Because when I asked the doctors, they said, I don't know what is this machine. So I came to ask this specific question to you.
Okay, good question, because it applies to many other situations when you or a patient may be on certain drugs and you go on some form of complementary or alternative therapy or nutritional therapy, and things start to improve, and the question comes in, should I stop the drug? The answer is no. Right? The answer is no, because it is a doctor that started you or the patient on the drug. It is the responsibility of the doctor to decide to stop. Right? What you shouldn't stop is that whatever therapy that is working. Right? When the doctor reviews, the doctor will have no choice but will have to come to a stage where I have to take off the drug of this patient because he's now normal. But meaning, my message is, don't play doctor when it comes to dealing with the drug, but play doctor when trying to recover your own health. Understand? Because when you rely on the doctors alone, you end up with plenty of drugs, but not necessarily healthy.
Yes.
Yeah? I'm a medical doctor, I know.
Thanks for the answer, doctor. But you see, what happens is this: my mother takes, she's a diabetic also. Okay, she takes the Lantus injection, and also she takes the Januvia. Okay? I noticed that when I monitor her blood sugar twice a day, using E-Life, it has improved the blood sugar level, such that I can actually do not give her the diabetic medicine because I can see improvement in the machine. And what I can't check is the thinning of the blood. Whether if I give her with E-Life, it thins the blood a bit also, and when I give the Tiglit, it will over thins the blood. That's where I'm afraid of this.
Okay.
So there's no machine to monitor the thinning of the blood. That's what I'm asking, you see. But with blood sugar, I can monitor. With BP, I can monitor. See,
Okay, even the blood thinning should also be monitored, not by the patient, but by the doctor. Because there are tests that the doctor does to see whether the dose is appropriate or not. Because treating patients with blood thinners can be dangerous. So there is a way we doctors monitor. Yeah, right now the doctor, that part the doctor monitor. You know, blood sugar, you know, you can monitor. But by the way, that's good that you mentioned this now. We have a practical actual case of illustration of E-Life improving the assimilation of glucose, that the control becomes much better.
Yes.
Okay?
Yes.
All right. But how did the E-Life help the glucose control? Right? The big way is by allowing now the cells to use the glucose so that it can work. Right? This is what the drugs are supposed to do. And there are many cases similar to your mother. Right? Go on some form of natural therapies. We're using this electric machine, but I consider this as natural as opposed to using drugs. Okay? Meaning, when your mother's blood sugar improves, it is because she has become healthier through E-Life. Alright? Which is different from if you take a drug and the blood sugar improves. The blood sugar improves not because she has become healthier, it's because of the drug. You stop the drug, it's going to boom up balik. Okay? You stop the E-Life, it's not going to boom up just like that. Alright? If you remember the slide about the weight loss BMR just now, 1 month later they still check the group. the effect was still there. 1 month after stopping therapy. Alright? If anybody is on drug, 1 month later you check, well, after stopping the drug, yeah? You take anyone on high blood pressure drug, diabetes drug, right? You stop, and 1 month later check what happened. You want to go to the house to check, sorry, please visit the grave.
What test would that be in the blood thinning? Is it a viscosity test?
Sorry?
The test for the blood thinning of the... What test?
No, this is medical part. They have the figures.
Who do we consult
They should
for
know.
that test? Who do we consult what test to do?
No, whichever doctor that has prescribed that is responsible for that.
Yes, next question.
Salam Dr. AMIR.
Salam.
Shafi. Yeah, I was involved in a very serious road accident about 5 years ago. And my C456, and my motor and sensory nerve has been ruptured. And a total paralysis in my upper leg. So I was wondering if this therapy can help in any way to improve my condition.
I start first, no promises. We have to be careful, no promises. But from what we know that it can do, then there is reason to expect that it should be able to help you. Okay? Now, the second part. Even if after going through the required sessions and you see no improvement in that part, you have not wasted your time or your money. Because there's so many other benefits. So you must know. There's another aspect of doing this kind of therapies as opposed to taking drugs. If you take a drug, even if you get the benefit that it's supposed to give, you still have 3 pages of side effects. What more if you don't get what you want? You still have the 3 pages of side effects. When you go on natural therapies, when you go on nutrition therapies, when you go on exercise, when you go on this kind of thing, it's not 3 pages of side effects, it's 3 pages of other beneficial effects. So even if you don't get what you wanted in the first place, you have not wasted your time.